This podcast, a simple summary of a scientific peer-reviewed paper, is made with the help of AI by Big Head Pain, Dr. Faraidoon Haghdoost. Today's episode features the study, Safety and Efficacy of Low-Intensity versus Standard Monitoring Following Intravenous Thrombolytic Treatment in Patients with Acute Ischemic Stroke, OPTIMISTmain, by Anderson et al., published in the Lancet in May 2025. Imagine a patient has just received clot-busting medication for a stroke. The current guidelines, based on protocols from the 1990s, require very intensive monitoring, sometimes every 15 to 30 minutes for hours. But is this necessary for everyone? Could less frequent monitoring be just as safe, especially for people with mild to moderate stroke? This international trial, called OPTIMISTmain, tried to answer exactly that. Researchers studied over 4,900 patients in 114 hospitals across 8 countries. All had received intravenous thrombolysis and had mild to moderate neurological symptoms. The trial tested 2 different approaches to monitoring in the 24 hours after treatment. Standard monitoring, frequent checks every 15 to 30 minutes in the first hours, then hourly checks. Low-intensity monitoring, fewer checks, for example, every 2 to 4 hours after the initial period. The key question was whether low-intensity monitoring would be non-inferior to the standard approach. In other words, whether outcomes would be just as good. And what did they find? The primary outcome was the rate of poor functional recovery, meaning moderate disability or worse, including death after 90 days. The results showed that 31.7% of patients in the low-intensity group and 30.9% in the standard group had poor outcomes, almost identical. However, because the statistical margin of non-inferiority was narrowly missed, the result was labeled as weak evidence of non-inferiority. Importantly, serious complications were rare and similar in both groups. For example, symptomatic bleeding in the brain, a feared complication after thrombolysis, occurred in only 0.2% in the low-intensity group and 0.4% in the standard group. Other safety outcomes and patient satisfaction scores were also similar. Interestingly, fewer patients in the low-intensity group were admitted to the intensive care unit, and nurses reported that the reduced monitoring gave them more time to educate patients and focus on holistic care. So, what does this mean? While the evidence wasn't strong enough to declare the new approach fully equivalent, it certainly suggests that low-intensity monitoring could be a safe option for many stroke patients, especially when resources are limited. It also opens the door to updating old protocols that may no longer fit modern stroke care. This study is a great example of how changing one simple aspect of care, how often we check vital signs, could have big impacts on workflow, patient experience, and even hospital costs without sacrificing safety.